First time when I went to Surat to procure the organ in 2006, I met Mr. Nilesh Mandlewala there. He was also interested in the same activity of deceased donor transplantation. This transplantation of those individuals who can receive the kidney from a deceased donor. And since we have a common interest, we came much closer with each other. And subsequently, he involved actively with our team also to a great extent, in a sense. Whenever there is a deceased donor or a cadaver donor, brain dead person, he was involving to the extent his whole night and day, staying along with the patient, relatives, communicating with us, sending the blood samples of the patient to our hospital at Kidney Hospital, and explaining the relatives that how good it is to donate the organs. We were close, and I did about 40 visits to Surat till now, and every time I found him on the occasion. I think on the bedside of the patient, talking to the relatives, explaining to the hospital administration also. One of the fundamental principle of organ transplantation is you have to give us like a donation. You can't, you don't have like the financial or any other kind of transaction. And he helped us out in solving certain of the problems where the demand of the family or a hospital was to clear certain bills, and so he explained very thoroughly to the management of the hospitals and to the relatives also. And I think he has tremendous potentiality to grow further. Not only that, during the time of organ procurement he helped us out, but especially in accidental cases where the later on postmortem was required. He helped all the relatives of those patients who had a head injury or a road traffic accident and they were brain dead to undergo the postmortem. He has helped them a lot. I think which is one of the most traumatic procedure after the organ donation is to undergo the postmortem by the of the dead body. And often, because the system sometimes is so difficult, that often the relatives are having a lot of pain about it, and he looked after that part very, very nicely. And I think we have a lot of respect for this, because we will stay on the side of the patient, because our responsibility is to take the organ and proceed immediately to Ahmedabad for transplantation. And local part in Surat, he looked after a lot. I think this is very genuine, and very few people can do like this. His area of interest is very clear. It's not only just putting order or command to the various level, but to function actually, and that is what his characteristic is. He worked on behalf of other organizations also, but and other team members, when we found they are not so efficient the way he used to talk to the patient and could convince more number of relatives when matter of organ donation was concerned, and when they were in dilemma. On a couple of occasions, we had been to outside Surat, at about 100 kilometers away from Surat. Also, there was a small hospital from where we procured the organ. And when I told him, he was immediately ready to come with us. Okay, we will come. It was Alipur Hospital, and he came there. There was another hospital also from some 200 kilometers from Surat, and he came there also. So it's not like that only his area of interest is in organization, but he has in fact worked in the system, try to understand the problems of the patient. And I am very much impressed by him in one fact, that his own father is suffering from end-stage kidney disease, and he has never asked for any organ to be transplanted in him. That was the best aspect probably, and I should say best in the way, because he never want to put himself in a condition that what his activity is doing, he want to earn out of it. So that is the best aspect. Otherwise, the work which you do, automatically the prestige of it goes down significantly. But he never did it so, and it has put himself in a very, very prestigious, very reputed person also in my mind. I am very clear about it. Even since last 1 year, he is very busy with his chamber, and we do not have a lot of communication. But because the activity which has been generated by us, by him together, and we continue going now to Surat when he is not there also. But that fruit we are seeing, there is a lot of efforts put by him, and I believe more thing can be done, because now we have started liver transplant program, and recently we got about 4 liver from Surat, very short, just last couple of months or so, along with the kidneys also. And I think with the more awareness about this program, more involvement of the NGOs, like we are the government hospital, and at the same time more involvement of the various NGOs who could not do directly but could contribute the way Nilesh Bhai has contributed. And I think our association with Nilesh Bhai will be continue, and his efforts, our efforts together, we can establish a good state program, maybe the national program in future also. But I think that is the vision which we have, and we can grow like anything. See, another important aspect is that Surat does not have kidney transplant program or liver transplant program. Even in entire Gujarat, we are having liver transplant program. But still, this man has involved himself, and I say, like, till date we could procure about 54 kidneys from Surat, and many livers also. I don't have exact number remember, but out of that 54 kidneys procured, 52 kidneys I have procured, 2 my colleagues have procured. Most important thing is Nilesh Bhai is always present. His presence itself makes a lot of difference. Easy in job, starting from the identification till the final cremation of the patient. He is involved into that. Even later on, he does the follow-up of the patient's relatives, that after 15 days or so, everybody is okay at home or not. That is him, and he is a good social worker, I believe. He is having a capacity to lead many things also, and he will be a leader also in this field if he want to do a great job. I think under his leadership he can create a lot of many more people he can train, and he can expand this activity further and further. In a nutshell, he himself is a good social worker, good leader, and good trainer as far as our association and deceased donor transplantation is concerned.